because our goal is really to provide the best care for them and for their baby. And it's to their advantage to have that important information shared. So that has worked well. It wasn't easy to get there. It took us a couple of years, but that has been really the foundation of how we share information. The other thing is that we're fortunate in Vermont law to have a provision which allows service providers to come together and share information where there are child safety concerns, and to work in partnership with our child welfare agency. And so when we don't have that release of information, but we have a child safety concern under the same guidelines that would enable child welfare to get involved, we can share that, that child safety risk information as a team. A couple of other things about our information sharing is that we don't use electronic information sharing at this point. We still, as a team, there are service providers within our team that do share information electronically through the electronic health record. But as an overall team with community-based service providers, we don't have the means to do that confidentially yet. And so when we come together at that monthly team meeting, we're sharing hard copy notes. And those are client-level information, very specific to each client, those notes. I wanted to talk just a little bit about the cost because people ask about this, and those of you that are looking to have a collaboration in your community are probably going to want to know that. So most of the team provides, their services are provided, by their respective agencies. When we come together as a collaborative, that is time that that is provided in relationship to the services that they're provided. My time as a facilitator is supported by our alcohol and drug abuse program of our health department, so by public health. Some agencies can bill that time as case management or case coordination. And it comes to about 30 staff hours of the specific collaborative approach on a monthly basis. So again, we look at that as a value-added cost of collaboration. In terms of the services that are provided specifically, most women are eligible for Medicaid, and then that covers their MAT through labor and delivery and 60 days postpartum. And then many are able to receive medical care through federally qualified health centers after that. The MAT funding and care coordination is provided through an initiative of our alcohol and drug abuse programs, and that does provide ongoing substance abuse counseling through the MAT providers in partnership with community-based treatment